Welcome, everyone, to this episode of BioTherapy Live. Thank you for joining, either live or perhaps in the recorded session you'll be watching. We're going to begin with a little introduction that Albert has arranged, and then we'll talk about today's program on leech therapy, surgery, and the current status of it in Israel. Take it away, Albert. Welcome again to everyone. We have a few more guests. That's great. Today's program is on Hirudotherapy, surgery, and the Israeli experience. And we have one of the not just Israeli experts, but international experts on the topic, Kosta Mumcuoglu. Dr. Mumcuoglu received his bachelor's degree in 1972 and his PhD in 1975 from the University of Basel in Switzerland, studying both zoology and dermatology. He is currently professor at the Hebrew University Hadassah Medical School in Jerusalem, where he has been teaching and doing his research for about 40 years. He is or has been also a faculty member of universities in Switzerland, Turkey, and Tehran. He is well known for his research on parasitic arthropods, such as lice and bedbugs, midges, fleas, mites, ticks. And for the past 30 years, he has been a leading force for research and clinical care in maggot therapy and leech therapy, hence his connection with biotherapy. In addition to being a member of multiple scientific societies, he is the chair of several, including the International Biotherapy Society. He's received multiple awards for outstanding achievement, including the Better Foundation's first William S. Baer Award for the Advancement of Biotherapy. He's also one of the editors of a book that I meant to bring to my desk. I'm going to grab it just a second. He's also one of the editors of Biotherapy, History, Principles, and Practice, and wrote or co-wrote the chapter on leech therapy in that book, as well as several other chapters. So without further delay, welcome, Kosta. We all look forward to what you can share and teach us today.
Thanks a lot, Ron, also for the invitation, also for all these nice words. I'm going to share my screen. I hope you are seeing that. As said, I'm going to talk about the use of leeches in plastic surgery, the experience which we had in the last 20 years so with leeches, And I would like to stress that I am a PhD. Accordingly, I did everything under the supervision and responsibility of the treating physician after having received the consent of the patient and the physician. I would like to tell you really a few things about the biology of the leeches in order to better understand what they are doing and how they are doing. As we know, leeches, especially the medicinal leeches, are living in sweet water pools, slow running water, lakes with plenty of plants, and they are amphibious. That means they can stay inside the water and outside, and usually they feed on fish, frogs, and mammals. They are blood feeders. As we know also that they have two parts, the apical and the anterior and posterior part of their body, each with a sucker. And in the anterior part, in addition to the sucker, there are also the mouth parts, and in form of three jaws, as we can see it here. If you look a little bit closer, we will see that these three jaws look in three different directions, and they work like an electric saw, working all the time, being all the time in a movement and cutting really the skin, and are trying to arrive in areas where the blood can stream and they can blood feed. Accordingly, also the wound or the bite which they cause, it is in form of, like, let's say, a Mercedes-Benz form. If you look a little more closer to these jaws, we see that they are composed from 60 to 80 teeth. And if you look even closer, we see that next to each teeth, there is also an opening on which the saliva enters to the skin of the animal or human. Accordingly, when we are bitten by a leech, as a matter of fact, we are bitten 180 to 240 times. Now, under normal circumstances, the leech can take blood and get full with blood within 30 to maximum 90 minutes. In this period, during this time, they take 5 to 50 milliliters of blood, and their weight increase approximately 10 times. Now, what leeches do, as many other blood feeding animals, during the feeding, they remove the superfluous water or serum, if you want, which is inside the blood, which they don't use it, and they excrete it, and they have more place to take more blood and concentrate the red blood cells in their intestine. I will try to show you. I hope it will work. It looks so, with a lot of, as we see it here, the peristaltics of the leech. Here it is the apical part, with the help of which it takes the blood. At the beginning, it is attached with the two parts of its body, but later, when it gets more and more full with blood, as it has to open it and became a kind of sausage full of blood. And you see already here a detached finger, and the leech work there to take blood. As we also know, what interests us and is the saliva of the leech. And we know that there are several vasodilators, there are spreading factors, and many anticoagulants. I cannot talk much about these molecules, but as you can see, there are inhibitors of coagulation like hirudin and kalin. There are such which are inhibiting the the activity of chymotrypsin, the factor XA inhibitors, complement inhibitors, vasodilators like histamine-like some substances, and also acetylcholine, and also kind of molecules which increases the inflow of blood, and accordingly the whole circulation of the blood gets better. And if we look that are acting in different areas of the blood coagulation, we understand why the leeches are not, the body is not capable in stopping the bleeding very quickly. And we know that the bite side can bleed for hours. Since 1960, leeches are being used in the plastic surgery, and this for compromised microvascular free tissue transfers, replanted digits, ears, lips, and nasal tips, or flaps and grafts. All this when the venous outflow cannot match the arterial inflow, which can lead to venous congestion. And in this case, we use the leeches. And we know that if this situation continues and is not corrected, that the cells can die and the flap or finger may be lost. We use the leeches until the angiogenesis improves and becomes autonomous. And as we will see, it takes a few days until the case. Here, if we can see that what we talk about schematically, you see that the blood through the arteries is coming inside the finger, but has difficulties to go out through the veins, and there is a venous congestion. Although usually hirudotherapy is used as a last way in these situations, but lately we have more and more, we succeeded in convincing the physicians not to use it as a last possibility. Then physicians usually use the warming, immobilization, elevation of the injured area, all kind of aspirins, heparins, etc., and vasodilators to improve the venous congestion. As we know, since 2004, the FDA approved leeches as a medical device in the area of plastic and reconstructive surgery. And this treatment modality is used really practically in all countries. And since 2003, it is used also in Israel. And we use it especially to salvage fingers, nose flaps, and scars. And I will show you several examples. Before we start the treatment, first we inform the patients about the benefits and potential risk of the treatment. That, as I told you, we receive its consent. I will talk about more in detail. I will use a prophylactic treatment with antibiotics, but for any case, we'll rinse also thoroughly the leeches which we are going to use it in order to diminish the bacterial load which is on the surface of the leech the moment we remove it from the water in which it stayed sometimes for days. Of course, we clean the wound from any kind of gels in order not to disturb the leech from feeding. And we apply a necessary plastic membrane or gauze, etc., in order that the leech, which is attached later, it will not enter inside the dressing, and it will be difficult to find thereafter. We use this method to apply the leeches. We use we wear nitrile or latex gloves through which the leeches cannot bite us, so we can touch hold the leech and introduce it inside a syringe. Before that, we cut the apical front part of the syringe, and which would allow to introduce inside the syringe the leech, and immediately we close the way with our finger so that we have a complete control where the leech can start blood feeding. Usually we have a small area on which the leech should start blood feeding. So we come with our syringe, we remove the finger and let the leech attach to this area which we want to attach. And the moment we see that it is attached, so we remove slowly the syringe, we can also help the leech to go out, because as we see, after half an hour, the leech is much, much bigger, and accordingly, it would be no place for the leech to stay inside the syringe. Yes, that's what I explained. Now, the moment that the leech, we will see it refuses to take blood in a given area, together with the syringe, we move the leech to another, to adjacent area, until the leech finds an area from which it can take blood. And if we see that nothing helps, sometimes it helps that we puncture the skin with a sterile needle, and the oozing blood stimulate the leeches sometimes to take blood. And the physicians in such case remove also the fingernails, and in which case it is easier to put here the leeches. We never put it on the internal part of the hand, the leeches, where the skin is quite thick, but surely on the dorsal part. Although sometimes the leech is attached and stay on the skin, but doesn't mean that can also take blood. We have to survey the leeches in the coming 15 to more 20 minutes until we know that it is really attached, and start with the peristaltic movements, which means that is blood feeding. And in case that it is detached, so you have to remove it and start perhaps with another leech. And as we cannot always wait for an hour and a half, so we usually ask the help of a nurse or the relatives of the patient to survey the leeches until they are ready to drop, and we explain them what to see, to look for, and when to ask for help. Now we put the leeches usually in the areas, in the dark areas of the flap or finger, where the venous circulation is much less good. And as I said, if we see that they are not ready to take blood in this area, so we remove the leeches in adjacent areas until they found a place where they can blood feed. There is no really law how many leeches you can use it. Usually they use something between 1 to 10 leeches. But the degree of venous congestion, which is estimated from the percentage of the violaceous color of flap, skin, pedicle, then the testing capillary refill and color of the oozing blood. All this give us an idea how good the bleeding is and the congestion is, and the more the blood, the oozing blood stops after the leech dropped from the area, the more the violaceous color remains, so we have to be more aggressive. From such a case, I asked the physician to put, so as you can see, 3 to 5 leeches, and to repeat surely the first day at least twice, and the following days, according to the situation, the more the bleeding continues, as I said, the more clearer or brighter areas appear, so we can go down with the number of leeches. As we said, the leech therapy is used until venous capillary returned and became autonomous, and that is due to the angiogenesis. Usually we use this treatment modality for 2 to 6 days. And of course, as we said at the beginning, the leech takes 5 to 50 milliliter of blood, but that is nothing compared to the oozing blood, which can, under circumstances, continue for 24 hours. Therefore, we have to evaluate the hematologic parameters. There are some telling every 4 hours, others they say 6 hours and even more. So that depends from the physician how often has to check these parameters, and of course give blood transfer blood in case that is necessary. We really we do blood transfusion in many cases, which from one side the patient is bleeding, and on the other side we have to give him blood transfusion, because sometimes the bleeding is not sufficient, the venous bleeding is not sufficient, and so the physician prefer to leave the blood oozing from as much as possible from the wound. I'm going to show you several cases of patients which were treated with leech therapy in plastic surgery, in the orthopedics department, in hand surgery department, and this gentleman who was 44 years old cut his 4 fingers with an electric saw, and came to the emergency room. The physicians, the plastic surgeons, tried to prepare some flaps and cover these parts of the fingers, as you can see it here, and that was the situation shortly after this surgical intervention. But as you can see, the skin becomes darker and darker, which means that the venous stasis exists. There is a venous stasis, and the patient can lose these grafts, and in which case we start with leech therapy. In this particular case, we did it for 3 days, and until the congestion improved. That is the final situation case of this specific case. It was a teacher, and it was his right hand, and he went back to work, and he was able to write. This 8-year-old girl put her hand next to the door, and someone closed it, and as a result of it, cut the apical part of the finger. They sutured it back and put a flap in this area, but it didn't succeed, and they lost this flap, which they put it in the first moment. Later, they took some parts of the toe of the leg, and they transferred it to the thumb. And as we can see here, not so much, but with the time it became also darker and darker, and we had to intervene with our leeches. This photo, you already saw it. So we put the leeches in only this specific place. And we could do it only with this system because just catching the leech and trying to convince to stay in a given area is practically impossible. It will go anywhere except in the area you want, because here is the bleeding also the last good. And that is the result of this intervention. As you can see, the thumb and the toe, and after 6 months was everything okay. This gentleman cut his entire hand, arm in this area, and apparently it was quite easy to reattach all these veins and arteries, etc. But in this situation, he lost a part of the skin, and for this they put a free flap in this area. But as you can see also, it was very dark. It was at the beginning, congested areas, as you can see. We put it the leeches, and the situation started getting better and better. The bleeding was getting better and better until at the end, the flap was also saved. This lady had an operation with due to a tumor, and they put also a flap here in the area of the tumor, which was removed. And as you can see, it was also very dark and congested, and that was the result after the treatment. This gentleman on his big stone drop on his leg, and he had a big hematoma, and we tried to help him also with this with the leeches. His gentleman lost 3 fingers. We were able to save 2 of them. The third one was impossible. Also, this lady with the tumor at the beginning, the more or less bleeding areas, and later getting more and more brighter in color. Also the same thing in this situation. And that was one of the last cases which we treated. Also, his gentleman lost one of his finger, and here we see it, the result. Another one which I show you also with the film video clip, and we were able also to save this finger. Here this gentleman lost 3 fingers, and they were reattached. We were able to save 2 of it. And this young lady, she became a scar due to hot water which she received on her face when she was 14 years old. When she was 18, they did an operation before. They put a kind of balloon here under her skin and put more and more air, so increase the volume of the skin. And in a moment, they pushed the skin, they removed the scarred skin, and they pull the normal skin on this area. And we help also in this case with the leeches. Same also with this young gentleman who had also a scar, and they cover it with skin, adjacent skin, and we put the leeches for this purpose. Since 2003, we treated close to 150 patients. Here you see the ages. We saved 67% of the fingers and 97% of the flaps. Of course, anybody can tell perhaps what would happen if we would not use the leeches. How we know it? It was because of the leeches. Of course, we can't say that 100%. We are dealing with open clinical studies, but on the other side, if you see the situation as I showed you in the slides of the situation, I think the experience of a physician is good enough to say that there are little chances that they can save the finger or the flap. And if we change the situation, so we think that it's because of the leeches. The treatment in case of fingers, it's about 3 days. In case of flaps, close to 7. What are the contraindications? As usually arterial insufficiency, immunosuppression, sepsis, which we are going to talk, but surely we don't start treating a patient who is already in sepsis. Of course, if he suffers from anemia, hemophilia, hemorrhagic diathesis, hypotension, if the patients refuse for blood transfusion, and we must be very precautious when we use other anticoagulants like aspirin and heparin, because we know that also the leeches, they are injecting a lot of anticoagulants, and it could be critical for the patient. What are the side effects? Our psychological effects, especially in young patients, and our youngest patient were 8 years old, and we had difficulties to convince her to collaborate. We even brought the clown of the hospital to help us to convince her. The local bite reaction isolated in form of a Mercedes-Benz sign, which usually can stay for days, but sometimes for weeks, and it could be a little more problematic if it's in the area of the face. Rarely there are regional lymphadenitis, swelling, pain, regional lymph node, swelling of and increase of the regional lymph nodes, and blood loss we talk about with so much bleeding. And about this problem I would like to stay, especially this. As we know, all leeches, medical leeches, have a symbiotic bacteria like Hydrophila, Aeromonas veroni, or Aeromonas sobria, which are important for the leech and help the leech to digest the blood. They are providing essential nutrients such as vitamin B, and they produce these bacteria produce themselves antibiotics, which prevent colonization by other potentially harmful microorganisms, other bacteria, so that the blood can stay in the intestine of the leech for months without decaying, and that is being done by the symbiotic bacteria. But this symbiotic bacteria can cause also sepsis. Therefore, first of all, as I told you, we wash thoroughly the leech before we use it in order to diminish the bacterial load. Then we use a prophylactic treatment, and usually we don't use prophylactic treatment if we apply it on intact skin, but the moment we are working next or using the leech next to an open wound, and then we have to use a prophylactic treatment in our hospital, and in discussion with our microbiologists, we give it oral ciprofloxacin 500 milligram or trimethoprim sulfamethoxazole in these concentrations. That is for adults, and for children they are using only the oral trimethoprim 10 milligrams per kilogram. That we give it in any case. As we know in the literature, there are cases where sepsis has been observed during the leech therapy. We apply this, we give it this prophylactic treatment approximately 30 minutes before the leech therapy, because we know that in this case, the antibiotic concentration is maximal in the blood circulation, and we treat it only during the days of leech therapy, so we don't use it before or after the treatment. A few words about the maintenance of leeches in the laboratory. As we know, the leeches can stay without feeding for a year and even more, so that I keep in my laboratory a large number, let's say a few hundred of leeches in my laboratory by changing usually once a week the water, and we transfer it to a second clean container, but we leave the water to dechlorinate for 24 hours. Apparently, the leeches are sensitive to chlor. So we wait for 24 hours and we fill approximately three quarters of the container, we fill it with water. And as we can see, in this photo, we put also a stone, which the leeches use it to sorry, I forgot the process of shedding their integument. They are changing often their integument, like the snakes, let's say, and that helps them a lot to do so. And of course, we close it hermetically, that they cannot, but we leave it a place to the air to enter and have enough air for the leeches. And if people use smaller numbers of leeches, so something like that would also help. If you don't have it, just write to me. I could send you the recommendation which I use for the use of leeches in the reconstructive plastic surgery. I will be pleased to do so. And if you have questions, I would be happy to answer them. Thank you.
Excellent presentation. Thank you, Kosta, for that. Albert, are you able to help navigate to the yeah, there we go. So now we can see each other, or some of us can see each other. Thank you, Kosta. It was excellent presentation. I wrote down a number of questions before the lecture, and you answered almost every single one. That's how comprehensive it was. But before I ask my few remaining questions, I want to give everyone else a chance to make comments or ask questions. So, any questions from the viewers?
Apparently, you are the only one.
No. Gail has a question.
Gail.
Yeah, hi, thank you. That was excellent, very interesting. This may be obvious, but do you reuse the leeches or do you destroy them afterwards?
Never, yes. We never use it again. I mean, we destroy it. As you know, first of all, it's quite impractical because they are not ready to take blood again in the coming 1 to 3 months, you know. So definitively you cannot use for the same patient, but in the entire world, I think in all the health authorities, they don't allow for any prophylactic or precocious reasons, just it could be any kind of hepatitis or something like that, so that we usually kill them in 70% alcohol. Within a few minutes they are dead, and then we discard them as biological material.
I assumed. So are they fairly easy to breed, to raise?
I don't breed things. It's quite complex, and Dr. Naim Salam has a lot of experience about that. Perhaps he wants to say a few things, but it is really a very complex situation where you have to raise, to culture leeches, you know, in specific farms with running waters and blood feeding, artificial blood feeding. What I'm doing we import a lady in Israel who is treating patients for all kinds of symptoms and diseases. She imports leeches from either from Bulgaria or from Azerbaijan, and I just buy it from her twice a year, approximately 400 or 500 leeches. That's approximately the number which I use for plastic surgery. You must know that most of them also die, because I keep them until as long as they are active, and part of it die as a result of it. Accordingly, I don't feed them. I only change the water once a week.
Okay, thank you.
Let me pursue that one step further, Kosta. Do you maintain them at a refrigerated or cold temperature, so that, or room temperature?
Room temperature. Room temperature. I must tell, I did at the beginning tried to keep them in 5 degrees, but I had the impression that it was not big difference. Dr. Salam, can you say that, or whether the leeches survive better in fridge or in room temperature, or is there any other temperature, middle temperature, which would be even better for the leeches to survive even longer?
Thank you, your presentation, Dr. Mumcuoglu. Thank you very much. Now you can place for leeches room temperature very good, and need dark area prepare. Sometimes you can reduce temperature. 18 and 20 temperature very good for keep it condition. But breeding time need small higher temperature. Breeding time, culture time, 25, 27, very good temperature. Now, do you know everything I prepare culture condition in international, in Turkey now 11 have leech farm, and Azerbaijan I prepare again leech farm. But clinical situation very important, 18 and 20 Celsius degrees, and every time you keep you can keep a dark area.
Okay, thank you.
You're welcome.
I think that answered your question, Dron.
Yeah, very well. It did. Thank you. It's a little bit different from our experience. As some of you know, the Better Foundation maintained a leech research laboratory for several years, jointly with Monarch Labs in California. And we were studying how to raise the maggots in the laboratory. We were not as successful, or we found room temperature not to be as successful for healthy leeches as a cooler, slightly cooler temperature. But I think that's because the room temperature in Southern California is much higher than 20 degrees. And at the higher temperatures, the leeches dirtied up their water much more frequently. It had to be changed more frequently. They did not survive as long. Their metabolism is certainly faster, and they needed a blood meal earlier. When we kept them closer to 15 degrees, 15 degrees, yeah, that would be about right. 15 or even cooler, their metabolism was slower. They survived much longer. We did daily death tolls, so that's how we know that. And we were able to achieve the nice, convenient results that Kosta just mentioned of having to change the water only once a week and not every other day. Anyway, so that was our experience on that.
I knew that it is better, to have cooler temperatures, around 15, 18 degrees, but I don't have the possibility, in my laboratory to have that. It would be either 5 degrees or 24 degrees or 20, depending, we have usually around 23, 24 degrees room temperature, and that is the only thing which I can do. It was not because I preferred the room temperature.
Well, your results are very good nonetheless. And I guess that's really the most important thing, isn't it? Being able to maintain the leeches for 6 months or more without feeding them is, in my belief and in my experience, a significant accomplishment.
I didn't say that, but it is so that the situation, since in 2003, I realized that there were some physicians which were looking for leeches, in very special cases. So I took the initiative and I became, if you want, the center for leech therapy for maintaining leeches. And I am giving to all hospitals, practically all major hospitals in Israel, the moment they are asking. Now, although in Turkey there are very clear rules and regulations who can use the leeches, etc. And just the bottom line, you must be not only physician, but you have to have also a certificate, from after having taken a course in leech therapy. But in practical, in all other countries, there is no regulation. So it's also in Israel, which makes that I'm going from hospital to hospital, and often I invite myself. I write to the plastic surgery orthopedic department that I say, I know that you are using leeches and you are asking, but all the time I'm talking with the physicians, I realize that they really don't know what to do. Someone tells them use leeches, but then they don't know what exactly. So what I'm doing, I'm talking usually for 45 minutes. I'm demonstrating the leeches and explaining the most important things, how to use leeches, in a more or less optimal way, and not try, as I told you, because as they don't know, they catch the leech, which goes in all the direction, try to convince the leech to stay in a very small area, and they are desperate when the leech is not doing that. And then the moment I show them this syringe method, things become much more easier, etc., much more clearer. And I know which specific areas are important for the patient for the treatment, and I am concentrated especially that, so that I'm giving, if you want, private lessons to physicians and nurses in order to do it the best way they can.
That's very good what you're doing. First of all, it's going to make the therapists more comfortable with choosing leech therapy, not as a very, very, very last resort. And when you do anything as a last resort, a lot of time, a lot of damage has already passed, making the prognosis that much worse. And with knowledge, the outcomes should be potentially better as well. It is also not required. Education training is not required in the United States, even by the healthcare workers. A prescription is, but knowledge and experience of what to do when the leeches arrive is not a requirement. And I would emphasize the value of what you're doing with this brief story, that the story and something to remember is that these types of wounds can go bad no matter what you do. Even if you do everything right, these are serious cases. They can turn out bad. The grafts can be lost. People can be without anatomy, without function. I was asked to be an expert witness on a case of a therapist, a plastic surgeon, who used leeches to decompress a patient's congestion after reconstructive surgery. She became anemic. She needed a blood transfusion. She did okay, but the board of medicine actually took the doctor to court and said she shouldn't have used leeches. She didn't know what she was doing, et cetera, et cetera, et cetera. Very unusual for the licensing board to take a physician to court, even though the patient was not the plaintiff. But the board was determined. In any event, yes, I was able to show that anemia is a recognized complication, as you mentioned in the lecture. Transfusions are not uncommon, and that she had complied with the standard of care. But it would have been so much easier for her and for future clinicians if they could demonstrate that they've taken some training and so forth. And so I applaud your efforts and achievements in that area. Any other questions?
Yes. One of my goals to create this website, which I was talking to you at the beginning of this lecture, it was that also for those who don't have the time to hear me and us lecturing, etc., so that they can I can just give them the link and they can use it and learn in their time, because they are inviting me all the time at 7 o'clock in the morning when they have their seminars, etc. And if I'm going to the other side of the country, it must come up very early in the morning to be in these hours of the day. But I think in order to be on the safe side, I wrote everything, and I will send you also the link requesting that you put it also, if you want, also to the Better Foundation's website. That would be kind of recommendations as I publish at that time. And if you allow me, just perhaps as a last thing, if I can share a moment, it was I had put. Yes, we use it usually the Verbana or Orientalis as things I told you from Bulgaria, etc. We have the necessary permissions from the Israel National Parks Authority, to introduce or import living animals from outside the country. What is important to say that we always, each time we receive new leeches, we test them microbiologically and see that the bacteria, which are surely the Aeromonas, but not only, which are inside the leech or around the leech, they are sensitive. These bacteria are sensitive to this ciprofloxacin. And just a word about how to remove leech in case that we don't want anymore that stays on the skin. We usually take a gauze, put it little bit, 70% alcohol, and touch the head of the leech for a second. The leeches are very sensitive to alcohol, and they drop immediately. About the other things I told you already. I wanted only to check that was any question from my side which was not answered.
If I may, ask a question related to that, one of my questions related to that, but definitely send us the link, and Albert will help me to remember to put it, to post it with this video, the link to your website. That would be great.
That's all great. Thank you.
So with regard to prophylaxis, prevention of infection at the site of these bites and at the wound site, you have done some excellent work and publication on disinfecting the leech with ciprofloxacin, as I recall, shortly before use. And that was a great article, by the way, from, what was it, 8 years ago, 7 years ago, something like that. Have you continued that? Did you find it to be valuable? Did you find it to, over time, to be not worth the efforts? Have you done any other explorations on disinfected leeches?
Well, the idea was to show it that it could be done, you know. But as I'm not a producer of leeches, and as you saw, I'm using few hundred leeches per year, you know. It is surely not. But I know that there are people in Istanbul, they trying to do this method, you know, to disinfect the leeches. I don't know how successful they are, you know, because you have to feed them, as you say, as you know, artificially with with these antibiotics. Perhaps again, Dr. Salam, do you know whether in Turkey or somewhere else they are producing these, let's say, disinfected leeches, you know, by feeding them? Because I know there are also several publications trying to disinfect the leech by an exterior treatment, you know, by putting some antibiotics, etc. But we know that this kind of treatments are like this. That's my experience, that they are not disinfecting, really, surely not whatever it is inside the intestine of the, and that is the most important, this Aeromonas bacteria. And I know, but can you comment to that, Dr. Salam?
Okay. You can use disinfectant maybe before treatment. 1 week ago, you can use methylene blue disinfectant as disinfectant. You can use
Methylene blue.
Yes, methylene blue. Rivanol you can use for disinfectant, and sometime clinical time before clinical, you can use ciprofloxacin 10 milligram and liter solution. You can use again 1 week ago. You can use, very important. Now you can use ciprofloxacin and Rivanol, another disinfectant. Sometime problem quickly Hirudotherapy. Very important. 1 week ago need using.
Hmm. Yeah, I know that they are doing that kind of disinfection. I'm not, I don't know how much it was really tested that they are disinfected as I did it, you know, by examining them again and after weeks and days, etc. But yeah, that is, yeah, surely there is still a lot to be done in this direction.
We did some work at our research lab on disinfection
Okay,
and found it to be difficult. Trying a number of ways, and perhaps we can talk about that at another time. But because it's already 2 o'clock, we should probably end here.
sure.
Maybe we will contact, people are invited to contact you afterwards for any additional questions.
Sure.
Thank you all for joining us. Thank you, Kosta, for another fulfilling educational learning experience. I hope to talk to you some more shortly. And with that, I'll say goodbye and good night.
Goodbye.
Thank you.
Bye-bye.
Thank you very much.
Bye.
See you.